Hello and welcome. Today we're diving deep into a fascinating, but often challenging, genetic disorder, cystinuria. We'll explore what causes it, how it affects the body, and what can be done to manage this condition. So, let's begin our journey into the world of cystinuria. At its core, cystinuria is an inherited genetic disorder. This means it's passed down through families. The culprit: mutations in specific genes, primarily SLC3A1 and SLC7A9. These genes carry the instructions for building proteins that are essential for kidney function. When these genes are faulty, things can go wrong in how the kidneys handle certain amino acids. Now let's get a bit more technical. These faulty genes affect a protein complex located in the kidney tubules. This complex is responsible for reabsorbing certain amino acids, specifically cysteine, lysine, arginine, and ornithine, back into the bloodstream. In individuals with cystinuria, this reabsorption process is impaired. This means these amino acids, particularly cysteine, end up in the urine at much higher concentrations than normal. Cysteine is the key player here because it's relatively insoluble. When cysteine concentration in the urine becomes too high, it can crystallize and form kidney stones. These stones can cause significant pain and other complications. Cystinuria isn't incredibly common, but it's not rare either. It's estimated to affect around 1 in 7,000 to 1 in 10,000 individuals worldwide. The prevalence can vary slightly depending on geographical location and population groups, suggesting some genetic variation across different ethnicities. The most prominent and often first sign of cystinuria is excruciating pain, typically in the back or side, caused by kidney stones. Other symptoms can include nausea, vomiting, blood in the urine as hematuria, and frequent urinary tract infections. It's important to note that some individuals with cystinuria may not experience any symptoms, especially early on. However, the risk of developing kidney stones is always present. Diagnosing cystinuria involves a combination of methods. A urine test, specifically a 24-hour urine collection, is crucial to measure the amount of cystine excreted. High levels of cystine in the urine strongly suggest the diagnosis. Genetic testing can also be performed to confirm the presence of mutations in the SLC3A1 or SLC7A9 genes. In addition, imaging techniques like X-rays or CT scans can help detect the presence and location of kidney stones. While there aren't distinct types of cystinuria in the classic sense, the severity of the disease can vary significantly between individuals. This variation is often linked to the specific genetic mutations present and how they affect the function of the protein complex. Some people may form stones frequently and experience severe symptoms, while others may have fewer stones and milder symptoms. The primary goal of treatment and management is to prevent the formation of cystine stones and manage any existing ones. This involves a multi-pronged approach. Firstly, high fluid intake is crucial to dilute the urine and reduce cystine concentration. Aiming for a urine output of at least 3 liters per day is typically recommended. Dietary modifications, such as reducing sodium and animal protein intake, can also help. Medications like potassium citrate can alkalinize the urine, making cystine more soluble. If stones do form, they may need to be broken up or removed using techniques like shockwave lithotripsy or surgery. While we can't completely prevent cystinuria since it's a genetic condition, we can take steps to minimize its effects. Genetic counseling is important for families with a history of the disorder to understand the risk of passing it on to future generations. Early diagnosis and adherence to treatment plans, including high fluid intake and dietary modifications, are key to preventing the formation of kidney stones and minimizing long-term complications. With proper management, individuals with cystinuria can lead relatively normal lives. However, the condition requires ongoing monitoring and adherence to treatment plans. Recent research is focused on developing new and more effective medications to reduce cystine excretion and prevent stone formation. There's also ongoing exploration into gene therapy as a potential future cure for cystinuria. These advancements offer hope for improved outcomes and a better quality of life for those affected by this challenging condition.